Hello, everyone. Hope all is well. This is Nurse Kelly with some information for you. I hear that you've been taking field trips to different places, and one of the places coming up that your field trip will be a trip to the doctor's office. And I know that most, if not all of you, go to your doctor's office at least once a year. Sometimes you may go every 3, 4 months, depending on what's happening in your life for checkups. But we're just going to talk about a general checkup, maybe once a year, your physical that happens. So, what's a little different these days from maybe when you used to go to the doctor is now what you'll see that healthcare providers, be them a secretary, a nurse, a doctor, everyone will be wearing a mask, and they may ask you to wear a mask as well if you can. Otherwise, for sure, they all will be wearing a mask, and they may be wearing a shield over their face as well. So they'll be wearing a mask because right now this will protect you from coronavirus. What you'll also see is you'll see that people may be wearing gloves as well. If not, they'll be washing their hands often throughout their visit with you. So, once you get to the office, your parent or guardian or whoever takes care of you the most will sign you in, and that lets them know that you are here and you are ready for your exam. You may have to wait a little bit, hopefully not too long, but in the waiting room, sometimes there's TV you can watch. So they'll call your name, and then you'll be taken back to the back of the office. Now, once you get there, you'll be going with either a medical assistant or a nurse, and they will look like this, right? They'll have their mask on. The medical assistant is going to get you ready for your exam. So, what they're going to do is they're going to take your height, right? See how big you've gotten since the last time you were there. Now, this only happens when you're here for a physical. So, if possible, you'll stand and you'll be measured against the wall with a big ruler. If not, that's okay. They can judge by how asking your parents, have you grown out of clothes, those kinds of things to let us know that you've grown. And then they'll check your weight. So your weight will be done either you standing on a scale, or if you're in your wheelchair or your other chair, they will sit you on the scale and they'll be able to weigh you that way. So height and weight are two very important things for us as healthcare providers. That lets us know how well you are growing, right? That you're eating well and you're getting all the nutrients that you need to get to grow. So two very important things. Other things they'll do before you get to see your healthcare provider is they will check your temperature, right? So this is a thermometer. This is a thermometer that doesn't have to touch you, doesn't have to go in your mouth. It just doesn't even go on your skin, against your forehead, 97.7. It's a little chilly in my house, but that will let us know how you're feeling that day. And they may actually take this when you come in the door as well, because in the times of coronavirus, sometimes you can't be seen if you have a fever. You also shouldn't come to school if you have a fever prior to school, but we'll talk about that at another time. So once they check your temperature, they're also going to check your pulse, right? So your pulse gives us an indication of how your heart's doing. It's a little beat right here, and they can count it and they can tell how good your heart's doing. They also will check for some of you, they may check your blood pressure. So, checking your blood pressure is taking a blood pressure cuff and they'll put it on your arm and they squeeze, squeeze, squeeze. It's a little uncomfortable, or they'll have a machine that does it. Over in a second, checks your blood pressure, and that also lets us know how your heart's doing. Now you are ready to go back and see your healthcare provider, and that healthcare provider could be a physician or a doctor, or it could be a nurse practitioner as well. Some of you go to places where they have pediatric nurse practitioners, and that's great. They do just as good and do just as well as physicians do. So once you get back there, you'll either stay in your wheelchair or you'll sit up on the table if you're able, or maybe you'll sit in your parents' lap, whatever comfortable for you. And the doctor or nurse practitioner is going to use their stethoscope, right? I'm sure you've all seen these before. I always have it around my neck at school. This stethoscope allows me to listen to parts of your body. So there's three parts of the body that they can listen to, right? So the first part they can listen to is to your heart, right? How well is your heart beating? Is it beating fast? Is it beating slow? How's it going? Do they hear any funny sounds? They're also going to listen to your back. And they're going to, if you can, they'll ask you to take a deep breath so that they can listen to what your lungs sound like, right? Some of you have asthma, so we want to make sure, or other breathing problems, we want to make sure that everything is all good there. And if you're able, they may listen to your belly as well, right? Listen to our tummies. So our tummies make sounds, and we want to make sure that lets us know that your stomach and tummy is working all the time. Some of you may have little tubes, right? Little buttons, and the stethoscope lets us know that that button is in the right place and that things are working. So after they use their stethoscope and look at those parts, they may also go get their flashlight out. And this flashlight allows them to look at a number of things. They may look at your eyes, right? They're checking to see that your eyes look good. They're going to look in your nose, right? They'll pull down your mask if you're wearing a mask, and then they're going to look up your nose. They're going to look in your mouth. So if you can, you're going to say, ah. If you can't, they may open your mouth for you, or your parent or guardian may help you. So here they want to look at your teeth, they want to look at your tongue, and they want to look at the very back of your throat to make sure your tonsils are all good. Then the last thing they're going to do is they're going to look into your ears, right? Check out those ears, see what they see, make sure there's not too much wax or any infections. Um, so that all will be done with the flashlight. The last thing they may do and they may not do is take a reflex hammer, which I didn't have one at home, mine's at school, and check your reflexes. And that just lets us know that your body's working and your brain is working well. When that's all done, then they'll have a conversation. They'll discuss the exam with your parent or guardian, whoever takes care of you, let you know how well you're doing, and some plans for the next couple months, and some health tips on how to be healthy for the next few months. So if I was seeing you today as a nurse practitioner and you were about to leave me, I would say that our health tips for today are to make sure that you're eating what you're supposed to eat, getting a good night's sleep, and that you are taking precautions against the coronavirus, which is wearing a mask if you can, washing your hands as much as possible, and social distancing, or staying in your home, right? Staying near your family, the people that you're around the most. The other thing is that it's now flu season, so I would recommend that you get a flu shot. Um, the flu can be spread just like coronavirus, and you don't want to confuse the two. Some of you can get really, really sick with coronavirus. Um, so once that's done, they may talk about medications that you may need, or anything that you need refills on, and then that's it. Sometimes maybe you'll get a book at the end so that your parents, guardians, or whoever take care of you the most can read to you, right? Because we know that students that are read to are more apt to speak more words, and it's good for your brain. And then they'll tell you, we'll see you 6 months, maybe a year, maybe shorter, but that's it. So that's it for your field trip to the doctor's office. Hope you all have a good day.